Experts agree that one reason for slow patient recruitment in clinical trials is because of the poor knowledge of innovative recruitment tools such as those available online. Harnessing the potential of technology and finding and recruiting patients saves a lot of time and money. A strong and targeted online or social media campaign helps to find the right participants for a study and to speed up the enrollment process overall. The consequences of delays in patient recruitment for clinical trials are enormous, ranging from delays in completing the study, huge financial losses, or even worse, failing the advancement in the patient care. Therefore, it's imperative to take proactive steps to prevent delays and ensure smooth running of patient recruitment. In the eligibility criteria of a clinical trial, a large timeline is necessary to recruit and screen patients. Although pushing off recruitment until later into the trial will definitely lead to delays, since it will take longer to complete the recruitment phase, and this may alter the outcome and outlook of a clinical trial. There is a study published by Kenneth Getz, a director at the Tufts Center for Study of Drug Development, and also associate professor at the Tufts University, found that there is a 94% increase of the recruitment period for studies challenged by recruitment. Or in other words, if you face a delay because you didn't take proactive efforts, usually leads to a double recruitment timeline period. Although this may be better than some of the trials that have to be canceled because of these delays in the process, or some of them have to have their funding reduced. The study also revealed that the highest increase in enrollment timelines occurred with studies centered on more common chronic diseases. For instance, patient enrollment timelines increased by 116% for trials focused on neurological disorders such as Alzheimer's disease, and up to 113% for trials focused on metabolic and endocrine diseases, including diabetes. This notable increase may be caused or worsened by the presence of many studies running concurrently, depleting the number of volunteers available. When it comes to last-minute patient recruitment efforts, there comes a need to take urgent measures to avoid further delays and also meet the extended timeline. These delays are expensive, costing sponsors about $60,000 per extra day, and the potential revenue loss can be at about $600,000 to $8 million every day the trial is delayed. These are staggering numbers, but it's not surprising since clinical trials are pricey in general. Delays in patient enrollment and in turn the overall trial may reduce the patent window and the profitability of a drug, as I mentioned before. This amplifies the financial loss associated with recruitment. Between 2008 and 2013, this financial loss has increased by more than 157%. This cost affects all stakeholders in the trial, including the investors, investigators, the sponsors, and CROs. Delays lead these groups to reduce their overall involvement in the trial, shifting their attention to other activities.